kidole kimoja hakiwezi kuwa chawa, unahitaji viwili vitatu ama a hard place like this, and that's what I'm going to present today, working with partnerships to improve our services. This is a case of Kilifi County Hospital. That's the county, as you are seeing there, a county amongst the 47 counties that we have in Kenya, in the coast region, about 1.4 million people, and that's where we are. That's just to remind ourselves about the sustainable development goals. I'll not go through them because I know all of us, I think, are aware about them. Our focus for this conference, I know, is the goal number 3, SDG number 3, which is good health for all, good health for all of us. What are we saying here is that maternal health, as we look at it, is a great foundation for us. It's a foundation to ensure that we have, a foundation towards a healthy nation, and we cannot run away from that. And while a lot of progress has taken place or has happened, we know that we are still far away to ensure that the mother, this pregnant mother, actually survives, comes to us from antenatal care to coming to the labor ward and getting out of that labor ward with a live baby. So we know that we still have a lot of work to do to get there, because today we still have maternal deaths, today we still have neonatal deaths. During my midwifery training in 1975, I cannot remember having, what one kichwa? Yeah, midwifery, I did my midwifery in 1975, and I cannot remember actually having a maternal death. The whole of the 9 months that I was in that maternity ward, which is now KMTC, changed drastically. I go to Kenyatta and I get lost sometimes, but I never actually witnessed a maternal death. I witnessed only one neonatal death throughout that time, and it was so painful for us, very, very painful, because it was in fact a colleague who lost that child, and it wasn't nice at all, at all, at all. So, critical role of this nurse midwife. Doctor here asked, who is a midwife? And I looked it down like this, because I'm like, how can he ask that question? And he works with midwives. He works with midwives, but he has a reason why he's asking. Because we like segregate ourselves and we don't know ourselves. Pauline here has talked about us again, that this idea of saying, I am just a nurse. It pains me when somebody just says, I am just a nurse. What do you mean you are just a nurse? You know, that question should not come out of our mouths. Anyway, this critical role of this nurse midwife, because the patient, I mean the mother, the pregnant mother, or even the mother who has an infertility problem still comes to the nurse. This nurse midwife is the first contact after registration. So this nurse comes here, and one of the areas that they work on or they look at is the prevention. They are looking at ensuring that they help the mother and open and counsel them on options for family planning, nutrition. Family planning will delay another pregnancy, and once as they are delaying that other pregnancy, then they are also getting stronger and stronger, so that when they get pregnant again, then they are very strong to move on and carry that pregnancy to term. So that is one of the areas that this nurse is engaged in. Then we are looking at risk identification, and risk identification still also starts from antenatal to the labor ward. What are some of these risks? They are the ones who actually will examine this mother for the first time, do a V for them, take that blood pressure, and they know that when there is danger, they are able now to ask the doctor to come in and assist this patient or this mother. I am proud to say that there are some gynae people who, doctors, who can stand in front of crowds like this and say, this mama made me whom I am today. And that was it, because the doctor will come and will tell them, I've checked on this patient, or I've checked on this mother, and this is how she's progressing. Going by the way she's progressing, I don't think that she will make it to deliver vaginally, and she needs assistance. And many times, that decision or that diagnosis is true, and they end up being sectioned, as it were, to be assisted to make sure that they have a live baby. Then treatment and care, again, is the same. This mother has delivered, she starts bleeding profusely, PPH, and it is the nurse, again, who is at the bedside. It is that nurse midwife who needs now to call someone else. First and foremost, do the needful to try to stop that bleeding. If it doesn't stop, then it is this same nurse who really needs to call for help. Now, we go to these strategic partnerships, and in this one, as I already said, kidole kimoja hakiwezi kuwa chawa. So Kilifi County nurse midwives have embarked, and I think this is happening in many, many places, bringing on board partners who are going to pull together financial support and finances, knowledge and skills, and but these people must have one vision, because if they are pulling on different directions, this partnership will not work. It will not help that patient. So what happens? We need strong leadership, somebody to guide them, somebody to say, yes, your partners have come to assist us. This is the direction I want to go. So if this is the direction I want to go, please help me to get there, not just to bring confusion in the process. So again, I've already said that is why they are leading in these partnerships, strategic, and that's why we are calling it strategic partnership, because it's strategic in the sense that each partner is bringing on board on the table something different, not duplicating efforts. These are the partners that are in Kilifi. Some of the partners, they may not be all, but these are the ones that I was able to capture. And we have Jacaranda there. Jacaranda Health is supporting the mothers, triggering with them with the SMSs, sending them SMSs to remind them that time for your antenatal care is due. Make sure that you do not miss your date. They also remind them that if you feel a headache that is not appearing that normal, please go for help. We have Stawisha Pwani. Stawisha Pwani is, among other things, is focusing on prevention of HIV, mother-to-child transmission of STIs, including HIV, and they are also strengthening the providers to consider using data to improve on the maternal health services. We have Maristops that is focusing on family planning, and especially the long-acting and permanent methods, and also the increased access through outreaches. We have Kenya Red Cross that is focusing on the girls, the girl child. GVs that is also looking at helping out with the adolescent health. And last but not least is the PSI Kenya that is also focusing on adolescent health, the girl child specifically. The ingredients are there. We need that partnership, the strategic partnership by knowing that we need the health providers, we need the stakeholders, and finally the community, because the community is the one that we are focusing on here. We need them because they know what can happen. They also need to know how to address whatever happens in their lives. So all these ones are the partners that we need. I have already said a lot has happened and a lot is happening. That does not mean that we have stopped maternal deaths, and we need to stop them. A death of one mother in the maternity ward should make all of us cry, because it means a lot for that family. So we still have maternal deaths happening. Not that because we have these partners, then it has stopped altogether, and we are, I want to believe the nurse midwife of Kilifi and elsewhere is working towards ensuring that does not happen. Again, we also have neonatal deaths are still also happening. And this is also another area that we need to address. You can imagine a mother coming to that labor ward with a baby that is, I only focused on the fresh stillbirths, because this is a birth that is happening at the delivery time, during the delivery time. And this is not what should happen to our mothers. So we want all of us to work together, and Kilifi nurse midwives are working towards reducing these numbers. As you are seeing, this, I just took data for 2022, so that it's not for a long period of time, but we are seeing it's still happening, and we need to stop that. So what have been the outcomes here? The outcomes, some of them, a few of them are enumerated there, that there is reduced duplication of efforts, financially, skill-wise, skills, capacity building. So they embark on different areas so that they do not have to repeat the same things over and over again. There's improved efficiency. As you are seeing, reduced maternal and neonatal mortality. Even though it's happening, it's drastically reduced, and we are looking at increased dedication and commitment by all the partners. Recommendations and the conclusions here is that the critical role of this nurse midwife in improving child health, maternal and child health, cannot be overstated. It's just there. You can't run away from it. And strategic partnerships empowers these nurse midwives to do the right thing and address the issues of SDG number 3, and that is good health for everyone, and ensures that mothers have access to quality services so that they are able to come to our facility pregnant, coming for delivery, and they live alive, they live for home alive with a live baby. By working together, we can create a better and healthier future for everyone, not just in Kilifi County, but globally. Last but not least, I just want to acknowledge those who have supported us here, myself being one of them, and all the other nurses from Kilifi. We have the county government through the CEC and the chief officer, the medical superintendent of Kilifi, who allowed me in writing to use the information from their hospital. The records officers who were able to, I was able to access that data which I've just shared with you people. And then the Nurses Association of Kenya Private Sector, they contributed a lot also for my personally coming here, and of course my family for this encouragement. Great people, thank you very much, and God bless you.